kids and their health. I'm Jennifer Williams, and I'm so happy to be here with you today. We are honored to have with us Dr. Uzma Hasan, Division Chief of Pediatric Infectious Diseases at RWJBarnabas Medical Center. We know there is so much in the news lately regarding RSV, COVID, the flu, even strep throat. So Dr. Hasan is here with you today to answer your questions and help keep your kids safe this winter. So, as always, if you have a question for Dr. Hasan, drop us a comment below, and please help me welcome Dr. Hasan. Hi.
Hi, thank you so much for having me.
Thank you. I'm so glad I always love when I get a chance to sit down with you, and I know that you're so busy, so we totally appreciate you being here today.
My pleasure.
So we have to dive in. Dr. Hasan, there is a lot going on right now in the world. There is so much virus and disease around. Let's just go into the big three. RSV, COVID, the flu, and strep throat is even running rampant right now. Let's start with RSV. Can you tell us a little bit about that? And what are some key things that we should know?
Sure, I can give you a nutshell version. So RSV is a virus that causes both upper respiratory and lower respiratory tract infection. Pretty much the entire US population under 2 has seen this virus at least once. There are some children who are at higher risk for severe illness, in particular children who are less than 6 months of age, children who are born premature, who have underlying chronic lung disease, have neurological disease, are at higher risk of illness, and those with persistent asthma may also experience severe illness. The way RSV presents in infants is that it may present as apneic spells, where they may stop breathing or have trouble feeding. That is extremely rare. The other illness that we see is bronchiolitis, which is inflammation of the lower respiratory tract, where they may present with trouble breathing, tugging while they're breathing, or belly breathing, etc. The older individuals will typically present with a pneumonia and can have severe illness that way. RSV is an illness that is spread through respiratory droplets, as well as the word that we use is fomites, which is virus particles that are left on surfaces. And that is why we remind everybody to practice cough etiquette and make sure that you're wiping down high-touch surfaces like doorknobs, etc., or laptops that you're using with germicidal wipes. So I think that what has impacted the respiratory season this year is COVID mitigation measures, masking, social distancing, the school closures and quarantine, etc., led to sort of an altered spread of your conventional respiratory viruses. So this is the time of the year that we see all these viruses, like November through April is where we see RSV season. I think we're seeing a more robust season because we have not seen the conventional spread of virus in the last 2 years.
So it's like it's been there but hiding a little bit.
That's correct.
Now it's out in the world. Is there an association with RSV and a future development of asthma?
That's a very good question. So, observational studies have shown that there is an increased link of RSV and asthma, similarly with rhinovirus and asthma. However, if you probe deeper, there is some concern that these children who develop persistent symptoms had some long-term respiratory illness that was going on. They also have exposure to secondhand smoke. These are kids who have a family history of asthma or a tendency towards atopy, like they have history of eczema or seasonal allergies in the household. So yes, there is definitely an increased risk associated with these respiratory viral illnesses.
And so are you seeing a lot, like you said, it's more younger patients and babies are getting it, and older kids too? Can they get RSV?
They can get it as well. Children less than age 5 can get it, and typically when we see the older kids coming in, it's usually children who have underlying asthma or chronic lung disease.
So something already affecting their respiratory.
Right.
And the flu. The flu is that seems to be with the RSV and flu, I feel like those are the two things that we're really hearing so much about.
That's correct. So, it becomes difficult for a parent to distinguish between all these viruses, and that is always a challenge. I think with the flu, a couple things that we see is it is acute onset severe illness. So you will see high-grade fever, you'll see body aches, headaches, runny nose, coughing, etc. And these children are miserable appearing. Often flu can also have secondary complications, so they can have ear infections, they can have nasty pneumonias. Very rarely they can have involvement of the brain, etc. The flu virus, as opposed to RSV virus, is mostly droplet spread, and it also can be transmitted in regular conversations. So if somebody is infected with the flu, they can generate a little amount of aerosol and spread it rapidly. And flu symptoms declare themselves a little sooner than RSV does. RSV takes about anywhere between 4 to 6 days from exposure. Flu is within about 48 hours of exposure. The kids who are vaccinated and adults who are vaccinated are protected from severe illness. So many parents ask us, well, why vaccinate if my child is going to develop the flu anyway? What we always remind them is their chances of your child getting hospitalized from the flu are very, very low if they're vaccinated.
Important there. And then COVID, still here, has not left the building yet.
That's right.
I'm sure you're ready for it to leave, but still here. So now how does that differentiate between the flu? Because there's some similarities there too, right?
That's very true. COVID illness is very similar to flu illness. You may see sore throat, you may see body aches with that, you may see vomiting and diarrhea associated with it. The smell and taste issues may be there. Interestingly, with the Omicron variant, the loss of smell and taste is a little less prominent. And also symptoms with Omicron seem to appear a little sooner. So, you'll see within 3 days of exposure, you may see symptoms of COVID appear. The couple things that, again, we remind parents, and I'm going to harp on vaccination again, but what we have seen throughout the pandemic is that kids who were immunized for COVID were unlikely to wind up in the hospital in the ICU setting with critical illness. So we remind all parents to make sure that the children are vaccinated and boosted with the bivalent booster in order to protect them against the circulating strain. I think the one other thing to remember is that the monoclonal antibody treatments that were available earlier in the pandemic are not effective against the circulating strains that are present right now for COVID. So more of a reason that you must vaccinate your children to protect them.
And so we've just covered a lot of information, and people are probably like semi-panicking still. What is your biggest advice to parents? Advice in the sense of not to panic. While it is out there, it's manageable, it's treatable, that sort of thing.
Exactly. I think that's a very important point to stress. So, a couple things to remember is this is the time of the year where we see respiratory viruses circulate. So, November through April, we always know this is the time we'll see our children get sicker than they usually do in the summer. The bottom line is that the exposure to these viruses also builds immunity, and if your child is vaccinated, the chances of seeing overwhelming illness are unlikely. You may see back-to-back illnesses, provided that you're seeing a period of recovery in between. Your children are going to be absolutely fine. I think that's one thing to remember. I think in the last 2 to 3 months or so, we have seen many nervous parents who have come in because of increased frequency of respiratory illnesses in their children. And we have an allowance of anywhere up to 13 to 15 upper respiratory infections in a year when the kids are starting up pre-K or kindergarten. And as they grow older, the frequency of illnesses gets less. I think, like I mentioned before, that because of COVID mitigation measures, the spread of viruses was different in the last 2 years. So we've gotten used to that. So I think the reminder that we must carry on with our normal lives. Just make sure that if you are sick or your child is sick, you are taking adequate preventive measures to prevent spread in the household and resume normalcy.
And we have a wonderful team of doctors here, of course, with Dr. Hasan, we're there for you to help you with any questions or any concerns that you have. But that's some excellent advice. And the last time I visited with you, you said, Jen, there's strep throat everywhere, strep. And when I saw you again today, you said it's still here. So what can you tell us about strep throat, and what do we need to do for that, and any information you have for us?
Sure, I can give you a quick summary of what's going on with strep infections. So we all know strep as the bacteria that causes a sore throat, and typically we'll see strep-related illness in the ages 5 to 15 years or so. Again, this is the time of the year where we may see a peak in illness. What has happened through the COVID times, and because of school closures and masking, etc., we did not see conventional spread of strep. This does not mean that the strain of strep that we are seeing is more virulent than the strains that we have seen in the past. That being said, we do want everybody to be aware is that we are seeing a rise in strep-related illness. And we always tell parents to recognize signs of invasive group A strep infection. What do I mean by that? Some of the kids with a strep throat can present with more severe manifestations. So if the child is having persistent fever or a rash involving head to toe, red eyes, they're having vomiting or diarrhea or muscle aches, etc. This is criteria to contact your pediatrician. Conventionally, strep will present with a sore throat, as we all know. They may have swollen glands, they may sometimes have a headache and vomiting, and they get started on antibiotic therapy, and they are within 24 hours, they're feeling much better. But the invasive group A strep infections are very rare, but often we have seen when we have a surge in flu activity, we may see a secondary group A strep infection happening. So we just want parents to be aware of that.
It's just one thing after the next. And it's interesting, they all present in very similar ways.
That's correct.
So this is wonderful information here today. Okay, so the next set of things I want to debunk a few myths that are out there. First one, kids don't get sick from COVID.
Okay, so I will say that we see the kids who get hospitalized with severe COVID illness, and I think that is not accurate that kids don't get sick with COVID. I will tell you that in our experience, 100% of the kids who were hospitalized with severe COVID illness requiring ICU stay were unvaccinated children. So that's something to remember. COVID can lead to severe systemic illness. There are certain ethnic groups who are more vulnerable. We have seen anecdotally, Hispanic African American kids are more likely to get multisystem inflammatory syndrome. This is a disorder that occurs, or an inflammatory disorder that occurs a couple of weeks post-COVID illness, and you will start to see these kids present with involvement of multiple organ systems. They can sometimes present with a Kawasaki disease-like manifestation where they will have red eyes, rash, swollen lymph nodes, and these kids can get very, very sick. And we have also seen kids hospitalized for COVID pneumonias. Most of these kids who have gotten hospitalized with COVID pneumonias have had underlying risk factors. And for the most part, children have done well.
Okay, next one. My child is getting sick all the time. There must be something wrong with their immune system.
I think we get asked this question very, very often, and I think, again, a reminder that you're going to see the regular spread of respiratory illness, and I think our view of things right now is skewed because of the last 2 years where we have been sort of indoors and masking, etc. I think that as long as you're seeing a period of recovery between illnesses, you're seeing your child growing well on their growth curve, you're not seeing any unusual pattern of infections where you wouldn't expect them. I'll give you an example, a child who gets hospitalized for a pneumonia twice requiring some sort of a surgical procedure. Those are the kind of things that make us worry about immune deficiency. Otherwise, I wouldn't worry about it.
Okay. Heart inflammation becomes a problem after receiving the COVID vaccine.
There has been a lot of discussion around this one. So, the mRNA vaccines, there was some association with a myocarditis or a pericarditis, which is basically inflammation of the heart that occurred post-vaccination, mostly This was seen in male adolescents, typically in sort of the 16 to 17-year age group. Reminder that this is exceedingly rare. So the anywhere up to about 60 to 100 per million doses of vaccine that were given, and these kids usually had mild inflammation that was picked up on labs, often had nothing abnormal picked up on imaging or function wise. These kids were followed more than 2 years out and have had no underlying cardiac damage, etc. They were treated with ibuprofen equivalents and they were fine. On the flip side, the kids who had COVID illness related myocarditis or inflammation often had severe loss of heart function, often required support for their heart, often were listed for transplant. So just again to sort of weigh the pros and cons of vaccine, and we know that actual illness, there is a much bigger risk with actual illness. That's the reminder to parents. Yeah.
Extremely rare.
Extremely rare.
Extremely rare. This one you touched on before, but I think it's important to touch on it again. Getting the flu vaccine makes my child still get the flu, so I shouldn't vaccinate at all.
So again, the one is that if they get flu, it is a much more attenuated form of illness. So their risk of getting hospitalized or severely sick is highly unlikely, versus the unvaccinated children can have overwhelming illness from the flu. So that's just a reminder to everybody.
Get vaccinated. And given it's a bad respiratory season, virus season, I shouldn't be around other people to protect my child.
So no, we don't want you to isolate yourselves. We want you to be able to lead your lives normally. I think that you got to take the adequate preventive measures in place. So if you have somebody in the household who's sick, it is optimal that they should mask in the household until they are symptom free. Again, we said wipe down high touch surfaces. If you are spaced out by about 3 to 6 feet distance, you are considered less likely to be spreading virus to everybody. But we would not say live in a bubble, because that on its own also has its consequences. You may not develop your immunity to that occurs post exposure, and I think that we need to be able to carry on with our normal lives.
Good advice. So talking about, we've talked about vaccines a little bit. What about antibiotics? Are those safe for children?
Very good question. So, this is the time of the year where we see antibiotic overuse in children who are coming in with fever, nasal congestion, just feeling miserable. And more than 95% of these illnesses tend to be viral, where antibiotics are not going to do anything. When we think about antibiotic use, there are certain criteria that we evaluate for. If there is a focus of infection, yes, antibiotics are indicated. For example, an ear infection or a pneumonia, etc. The overuse of antibiotics changes your gut bacteria, and there is emerging literature on that association of that with many other illnesses, diabetes, obesity, other things. Also makes you vulnerable for infections like C. diff, which is wiping out your good bacteria. Antibiotic use may also alter your gut functioning for months out. So we push towards rational use of antibiotics. Also, you may encourage your colonization with drug-resistant organisms. So if you use antibiotics, you're wiping out the good flora and inviting more drug-resistant flora to become part of the environment. So we say rational use of antibiotics, otherwise no.
Okay. So we're taking all of these steps, or we're learning a lot today, but if my child is sick, what steps should be taken?
I think key things first is the key component of managing all of these illnesses is supportive care. Hydrate them well, treat their fever as indicated, and make sure they're well rested. And the one other thing that we always say is don't send your kid back to school or in a daycare setting if they have fevers and if they are floridly symptomatic. The criteria to return to school or return to daycare, they've got to be fever free for 24 hours and they've got to be symptoms markedly improved for them to be able to function normally.
And I know we've talked a lot about this stuff kind of going on right now that's hyper focused, but just regular checkups every year, how important are those?
That is extremely important. I'm so glad you brought
Yeah.
that up. I think that, the one is, I can't stress this more, is that your child's routine well visits must be in their medical home with your pediatrician. This is the opportunity for the pediatrician to identify any issues that are there and to provide sort of comprehensive care to the child. And I think that it is extremely important to have your annual well visit, screening of blood work as indicated, catching up on vaccines as indicated. So this is an extremely important point that you brought up.
And then vaccines. I know we've dived in a little bit, but other than the flu vaccine and the COVID vaccine, there are other things. There are other important vaccines that parents shouldn't be weary of getting.
That's exactly right. So a couple things to mention. One is that while we were talking about invasive group A strep infections, in the kids who have chickenpox or if they have flu, their risk of getting invasive group A strep infections is higher. Okay, kids who have not had their pneumonia vaccines are at higher risk of nasty pneumonias when they're getting sick with these respiratory illnesses. What happens is that the respiratory illness wipes out their defenses and you have secondary bacteria that come in as invaders. If your child is vaccinated, the chances of them doing that are very, very unlikely. We want to make sure that any children who are behind on their routine vaccinations, they must be caught up. This is the time to schedule your visits, annual visits with your pediatricians. Make sure that your child is caught up on all their vaccines.
And I know we've talked about so many, and we did touch on this a little bit, but what advice do you have for parents? We can't keep our kids in a bubble. Like, how do we, just keep helping them lead healthy lives?
I think that we need to let them resume normalcy. As a rule, I would say when the weather is better, outdoors is always safer for activities and gatherings than the indoor setting. Just make sure that they are, again, caught up on their vaccinations, eating healthy, getting enough sleep, and the bottom line is that if they're sheltered and kept away from everybody right now, whenever they get back into the community, their exposure is going to lead to illness. And if it does lead to illness, that is nothing to worry about, because that is, your child's immune system is strong and robust and can tackle that, and eventually they're going to be back to their normal setting. So and we encourage them to return to normalcy.
Yes, it's going to be okay.
I think so.
It's going to be okay. We're going to get through it. We'll get through it together. I always love sitting down and talking with you, so thank you so much for being here today. Is there anything else you'd like to add?
I think we've covered quite a bit.
We have. We don't want anyone to panic today. We just want to make sure that you have all the information that you need, and there's so much out there to help keep your child stay safe. And if you ever need an appointment or you have a question for Dr. Hasan, you can always call her office. That's 973-322-6600. Again, 973-322-6600. So we'll pin that for you at the bottom. And if you do have a question, you can always ask it and we'll pass it along to Dr. Hasan and get that answered for you. But again, thank you so much for being here. Best of luck to you. I know you're very busy these days, but we so much appreciate having you.
Thank you so much for having me and bringing this important discussion to life. Thank you so much.
Yes, you're very welcome, and have a great day and stay safe, everybody.